Examples of international solidarity continue in the midst of the coronavirus pandemic, as a Cuban medical brigade landed in South Africa to assist its efforts against COVID-19. The Chinese city of Wuhan no longer has any hospitalized COVID-19 patients. Malaria continues to be the main cause of death in the Democratic Republic of the Congo, with more than 13,000 fatalities registered in 2019. From the headquarters of Telesur English in Havana, Cuba, this is From the South, I'm Katrina Goss. Over 200 Cuban health personnel landed in South Africa early this Monday to assist the country in its fight against COVID-19. They were welcomed by various cabinet ministers, the Cuban ambassador to South Africa, and Cuban residents in the country. The medical brigade includes family physicians, epidemiologists, biologists, healthcare technology, engineering and biotechnology experts, and other specialists. This team will undergo a precautionary quarantine for the next 14 days. They will use this time to gain an understanding of the current situation in South Africa and the provinces they will be deployed to. Cuba has sent 22 medical brigades to 4 continents as part of the response to the coronavirus pandemic. According to the Johns Hopkins University, South Africa has reported over 4,000 COVID-19 cases and 87 deaths.
Every one of the Cuban health professionals who are part of this team for their personal commitment and sacrifice in order to assist South Africa's efforts to curb COVID-19.
Y tomamos esta oportunidad.
Queridos compañeros,
Dear comrades, on behalf of the Cuban collective in South Africa, we warmly welcome you to the beautiful land of Mandela. We are very proud of you, our best soldiers, the soldiers of the army in white coats, who were created by our commander-in-chief Fidel Castro.
And South African President Cyril Ramaphosa shared a message of solidarity and triumph of the human spirit in these challenging times on the occasion of Freedom Day this Monday, a public holiday that commemorates the first post-apartheid elections held on April 27, 1994, which saw Nelson Mandela become president. Ramaphosa also highlighted the special bond that Cuba and South Africa share due to their historic relations spanning decades.
This Freedom Day, let us stand united against this disease. Let us stand united against poverty, inequality, and hunger. We can only overcome this crisis and rebuild our shattered economy if we work together.
President of El Salvador, Nayib Bukele, authorized the use of lethal force by police and troops against gang members on Sunday in a bid to crack down on violence amid the coronavirus pandemic. The Central American country reported 24 homicides last Friday, the worst one-day toll since Bukele took office in June. By late afternoon on Sunday, police had registered another 29 murders, prompting Bukele to introduce tougher measures against gang violence. The president tweeted his concern that gangs were taking advantage of the pandemic to control the streets. The imprisoned members of rival gangs were also put into mixed cells this weekend, ending a separation measure that has been enforced for years. The 20 poorest districts of the Brazilian city of Sao Paulo have seen a 45% increase in the COVID-19 death toll in just a week. Former Minister of Health, Arthur Ochorio, described these figures as extremely concerning as they reveal the vulnerability of the population and the seriousness of the health crisis in the country. The number of COVID-19 fatalities reported in these districts rose from 474 to almost 680 in recent days. Meanwhile, in the richest districts, the death toll increased from 263 to almost 360, representing a rise of 38%. And our correspondent in Brazil, Brian Meir, brings us more on how the novel coronavirus is impacting on the poorest sectors of the population.
I'm standing on the north side of São Paulo near the neighborhood of Brasilândia, which is the hardest hit region in the city of São Paulo. Now, it's an area of massive favelas and working class housing subdivisions, and it's recorded the highest number of cases. But it's important to remember when you look at the media attention given to São Paulo and coronavirus that 1 in 5 Brazilians live in the state of São Paulo. And if you look at the per capita data on the pandemic, you can see that there are other states in Brazil that have higher per capita infection and death rates, and these are among the most poor states in the country. For example, Amazonas, in the Amazon region, the public hospital system's ICU wards have been packed at 100% capacity for over a week now. And the states of Ceará and Pernambuco, also in the impoverished Northeast, have their ICU wards with 100% occupancy as well. So it's important to note that although the coronavirus was originally brought to Brazil by the middle class, it seems to be spreading the hardest and the fastest right now in the poorest areas of the country.
Health authorities in Honduras confirmed that the curfew has been extended until May 3rd on Sunday in order to stop the spread of the novel coronavirus. This is a sixth extension of the curfew in the Central American country, which has recorded over 660 coronavirus cases and 61 deaths. Meanwhile, the president of Ecuador, Lenin Moreno, announced that as of May 4th, measures to address the COVID-19 epidemic will be in the hands of mayors as part of a strategy for the gradual lifting of the lockdown in the country. As of Sunday, Ecuador had officially reported 22,700 positive cases and 576 deaths, although the figures are widely expected to fall far short from the reality. Likewise, Paraguay's President Mario Abdo Benitez announced on Monday that schools will be closed until December. Paraguay has reported 228 confirmed cases and 9 fatalities. Meanwhile, Colombia began its gradual return to normal economic and productive activity on Monday. The move has received widespread criticism as it means thousands of workers could be exposed to the novel coronavirus. Colombia has not yet passed the critical phase of the pandemic. Meanwhile, Bolivian de facto authorities are implementing a total lockdown and the isolation of those who had contact with confirmed cases, as well as other measures recommended by the World Health Organization. As of Monday, Bolivia has reported a total of 950 COVID-19 cases and 50 fatalities. More stories coming up after this very short break, so don't go away. Welcome back to From the South. In the midst of the coronavirus pandemic, which has cost over 210,000 lives worldwide, the US President and his French counterpart agreed on the need for reform of the World Health Organization. According to the White House, Presidents Donald Trump and Emmanuel Macron spoke by phone on Sunday. The two discussed the fight against the coronavirus pandemic and progress towards reopening the world's economies. They also spoke in favour of holding a meeting of the permanent members of the UN Security Council as soon as possible to discuss the pandemic. The talks came after Trump cut off US funding to the WHO, a decision that was condemned by France. As of Monday, the United States has reported over 999,000 COVID-19 cases and more than 56,000 fatalities, while France has registered more than 165,000 positive cases and over 23,000 deaths. British Prime Minister Boris Johnson said the United Kingdom has reached a moment of maximum risk in the coronavirus outbreak, arguing that the lifting the nationwide lockdown too soon could lead to a second spike in cases. Johnson's Conservative government has faced widespread criticism for its mishandling of the epidemic, including failing to protect essential workers.
And we collectively flattened the peak. And so when we're sure that this first phase is over, and that we're meeting our 5 tests, deaths falling, NHS protected, rate of infection down, really sorting out the challenges of testing and PPE, avoiding a second peak, then that will be the time to move on to the second phase, in which we continue to suppress the disease and keep the reproduction rate, the R rate, down, but begin gradually to refine the economic and social restrictions.
The hearings in the US extradition case against WikiLeaks founder Julian Assange have been postponed due to the coronavirus lockdown, which prevents lawyers from attending court. On Monday, Judge Vanessa Barretza adjourned the case until May 4th, when a new date will be set, noting that Woolwich Crown Court, where the hearings last took place, only had availability for a 3-week period in November. Assange's lawyers have noted that the COVID-19 lockdown in prisons makes it impossible for them to meet with their client. Lawyer Edward Fitzgerald told the judge his legal team had been unable to speak to Assange for a month, but a few short phone calls. Spain began easing some lockdown restrictions on Sunday, allowing children to play outside for the first time in 6 weeks. The country has seen the 3rd highest number of COVID-19 deaths in the world and the 2nd highest number of cases, but the numbers are falling.
We have, unfortunately, as usual, 331 new deaths. We have already seen several days below 300. It is always a sad, but of course the evolution has an effect or has a clear comparability with the evolution in new cases that is clearly downward and that obviously gives us hope.
People across Germany are now required to wear face masks or some other form of facial covering on all public transport. The federal and state governments agreed last week to urgently recommend that people wear masks or some other covering on public transport and in shops. However, they are only obligatory in shops in some states. The 16 state governments of Germany are ultimately responsible for imposing and loosening lockdown measures. Germany has now reported over 158,000 COVID-19 cases, but a comparatively low death toll of just over 6,000. Engineers at a car parts manufacturing plant in Bosnia have come up with a low-cost ventilator built with locally available tools and infrastructure. The company usually produces inner bearings and precision steel components for European vehicles, but has now developed a prototype ventilator, which it is presenting to healthcare professionals. Bosnia is unable to compete with richer governments across the world to source additional ventilators. When the pandemic hit, its health system had fewer than 260 ventilators for a population of about 3.5 million. The country has reported over 1,500 coronavirus cases and 60 deaths.
It is a challenge, but in any case, we learned something. We already changed our way of thinking and began adapting to the changing situation. I hope that in difficult situations, such as this global pandemic, we can find our way around quickly, reorganize and do what needs to be done to help our community.
Children in a suburb of the Norwegian capital Oslo have begun returning to primary schools after they were closed for 6 weeks. However, some parents have expressed concern about the lifting of the restrictions in a country that has reported more than 7,000 confirmed COVID-19 cases and over 200 fatalities. Authorities claim the epidemic is under control as the curve of hospitalised cases has dropped significantly in recent weeks.
If it was up to me entirely, I would probably wait a couple of more weeks. Because I don't think we know, we have all the information we need at this point.
There's 3 things. All the kids and all the staff need to be well, so if you feel ill, you can't come here. And we have to keep distance, so they have to be at least 1 meter separated, and we wash our hands all the time.
The last 12 hospitalised COVID-19 patients in Wuhan, the city at the centre of China's COVID-19 outbreak, have now been discharged. The Hubei Province Health Commission reported the news on Monday, noting that all remaining patients in the province were located in Wuhan, the provincial capital where the coronavirus took the heaviest toll in China. Hubei has no more suspected cases in its hospitals, though 1,700 people who had close contact with infected people remain under medical observation. And meanwhile, Chinese scientists reported on Monday that they now have 3 possible COVID-19 vaccines in the clinical trial stage, but warned that vaccine development was complicated and that they would welcome global cooperation.
China has already supported the research of 5 vaccines, including adenovirus vector vaccines, inactivator vaccines, nucleic acid vaccine, and so on. Now all the vaccines are being developed steadily. The one that has made fast progress is the adenovirus vector vaccine developed by Mrs. Chen Wei. It was the first to go through phase 1 of clinical trials, and now it's in phase 2 trials. Now there's another one, Sinopharm's inactivator vaccine in Wuhan, which has started phase 1 and phase 2 clinical trials. There is also a third developed by Sinovac. So that means China now has 3 vaccines in total now in clinical trials.
And we're taking one last break now, but stay with us for more. Welcome back to From the South. Malaria continues to be the main cause of death in the Democratic Republic of the Congo, with more than 13,000 fatalities registered in 2019. According to a report issued on Saturday by the NGO Doctors Without Borders to mark World Malaria Day, children under 5 years of age are the most affected by malaria in the country. The report added that rural areas have been hit hardest due to insecurity and the difficulties in accessing healthcare. In 2019, Doctors Without Borders treated more than 750,000 malaria patients throughout the country. In this context, the Congo now faces the coronavirus outbreak, with 459 positive cases reported so far and 28 fatalities. Burundi's political parties started campaigning for next month's presidential elections on Monday, despite the global coronavirus crisis. With only 1 death and 11 COVID-19 cases reported in the country, which has conducted minimal testing, authorities are pressing on with the May 20th vote for a successor to President Pierre Nkurunziza, who has been in power since 2005. Unlike most other nations, Burundi has not put restrictions on gatherings or internal travel due to the coronavirus crisis, so campaigning should be relatively unimpeded. Tensions flared in Somalia over the weekend after the fatal shooting of at least 1 civilian by police enforcing coronavirus restrictions. Angry protesters in the capital, Mogadishu, burned tyres and demanded justice as they protested the curfew imposed during Ramadan. There's been growing anger among some residents over alleged abuses by security forces. Officials reported that a police officer was arrested for shooting at least 1 civilian. Somalia has reported 436 COVID-19 cases and 23 fatalities. Guinea crossed the symbolic mark of 1,000 coronavirus cases on Sunday, according to health authorities. The virus is spreading rapidly in the country despite the introduction of a curfew and compulsory mask wearing. The National Health Security Agency announced the figure on Twitter, reporting that 225 people have recovered from the virus. Guinea's death toll exceeds that of neighbouring countries, such as Senegal and Mali, despite the closure of schools, borders and places of worship, as well as restrictions on gatherings. Guinea has already been severely tested by the Ebola virus, which killed more than 2,000 people between the end of 2013 and 2016. A US expert has announced that his country's sanctions against Iran have blocked almost 90% of requests for medical supplies from the Islamic Republic. According to Rick Sterling, a global research columnist, the US sanctions against Iran have limited the country's ability to import medical equipment and supplies, as 90% of import licenses have been rejected by the US Office of Foreign Assets Control. During an exclusive interview with the Iranian news agency, Sterling explained that Iran's requests include the importation of equipment with pieces manufactured in the US and Europe, thus restricted by the sanctions. In the midst of the COVID-19 pandemic, US sanctions are creating shortages in basic medical supplies such as masks and making the outbreak much worse.